Hello, everybody. This is Professor Alexander, and today we are going to talk about Chapter 5, which deals with STI prevention, STI awareness, sexually transmitted infections. So let's go ahead and take a deep dive. Now, just remember, as I am speaking, you are taking notes. When you take notes, you retain. Okay, so let's go ahead and get into it. Chapter 15, sexually transmitted infections. Okay, the main topics are the STI epidemic, the principal bacterial, sexually transmitted infections, principal viral, sexually transmitted infections, vaginal infections, other STIs, ectoparasitic infestations, infections caused by STIs, preventing and treating STIs. These are the main topics covered in this chapter. So, the sexually transmitted infection epidemic. Sexually transmitted infections refers to more than 30 infectious organisms passed from person to person primarily through sexual contact. Incidence is the number of new cases. Prevalence is the number of total cases. The STI epidemic. The infection with an STI organism can take place with or without developing the illness or disease associated with the organism. For this reason, and because of sociocultural taboos, STIs have a hidden nature that makes them a particular threat to public health. There are two general types of STIs, the bacterial ones and curable, such as chlamydia and gonorrhea, which have kind of become very common in today's society, whether we like it or not. So you have to use protection if you haven't had that conversation with your partner. Viral and incurable but treatable, such as HIV infection and genital herpes. So we're going to talk about some of the differences between those. So STIs, the most common reportable infectious disease, STIs are often silent. They go undiagnosed because they have no early symptoms or the symptoms are ignored and untreated. Only a few STIs must be reported, right? So the ones that we hear about most commonly are gonorrhea, syphilis, chlamydia, hepatitis A and B, HIV/AIDS, and chancroid. Now, whenever we see a bar graph, just remember it's a good time to take notes, and reflect. Okay, this is a breakdown of the cases, infections of Salmonella bacterium that causes diarrheal illness, right? Who is affected? Disparities among groups. So gender disparities. There's a kind of biological sexism with women more susceptible to infection than men when exposed. Lesbian and bisexual women are also at risk for STIs, but at a lower rate. Men who have sex with men are increasingly acquiring STIs. So age disparities. Compared to older adults, sexually active adolescents and young adults are at a higher risk for acquiring an STI, simply because the older you get, the statistics show that you are settled down and are typically with one partner, as opposed to younger adults may have various partners throughout their early adulthood. Race and ethnicity in the U.S. are STI risk markers that correlate with other determinants of health status. Figure 2, race of chlamydia by race, Hispanic, ethnicity, and sex, United States in 2018. Right? So we're using the acronyms AI or AN for American Indians and Alaskan Natives. Native Hawaiians and other Pacific Islanders, you'll see the acronym NHOPI. Take time, take notes, and reflect. Take time, take notes, and reflect. Figure 3. Factors contributing to the spread of sexually transmitted infections are behavioral factors. So many behavioral factors contribute. Early initiation of intimate sexual activity. The earlier you start having sex, obviously you're going to be more prone to catching an STI. Sequential sexual relationships, including serial monogamy, short gap between partners, concurrent sexual relationships, overlapping partnerships, high risk sexual partners. So you might be with a partner that is promiscuous, or somebody that is a drug user would be considered high risk. high-risk sexual behaviors, inconsistent and incorrect condom use, substance abuse, sexual coercion, the lack of knowledge of and concern about STIs, erroneous perception of a partner's STI status. Factors contributing to the spread of STIs, social factors. So poverty and marginalization place individuals in groups in which high-risk behavior is common and access to healthcare is limited, right? You have to go in and get treatment if you acquire an STI. And it's harder to do that if you don't have health benefits. Access to high quality and culturally sensitive healthcare is imperative for early detection, treatment, and prevention. The secrecy and moral conflict about sexuality is a significant factor in the United States. Cultural stigma associated with STIs, general discomfort with sexuality issues. Factors contributing to the spread of STIs or biological factors. So certain biological factors also play a role. So most STIs are asymptomatic or symptoms are mild. So they go undiagnosed. You don't even notice them until they get out of hand. Sexually transmitted infections can be resistant to treatment and some cannot be cured. Like we talked about herpes. There's no cure for herpes. It can be subdued, but there's no actual cure for it. Adolescent women are highly susceptible because of an immature cervix, and vaginal douching also increase the risk. And a lot of women don't know that. So men whose penis is uncircumcised are at a greater risk of HIV and some other STIs just because of the opening is more prone to infections getting into the penis. Consequences of STIs. So women and infants suffer more serious health damage than men from STIs. Left untreated, some STIs can lead to blindness, cancer, heart disease, infertility, ectopic pregnancy, miscarriage, and death. People with STIs are more likely to get HIV. Direct cost within the U.S. healthcare system is almost $16 billion every year. So Table 1A is the principal sexually transmitted infections, bacterial STIs. So take a minute. On the left, you will see the breakdown from chlamydia, gonorrhea, urethris, and syphilis. Take time, read, take notes, and reflect. This is Table 1B is the principal sexually transmitted infections, viral STIs. So this is a breakdown of HIV, herpes, genital human papillomavirus, which is becoming a lot more common, and viral hepatitis A and B. Take time, read, take notes, and reflect. Look at the symptoms. Look at the time from exposure to occurrence, the medical and treatment involved in all of these viral STIs. And read the notes section, the comments section. Principal STI and other STIs, a further breakdown. On the left, you will see trichomosis, and followed by pubic lice, crabs. Read the symptoms, time from exposure to occurrence, read the medical treatment involved in trichomosis and pubic lice and crabs, and also read the comment section. Continue to learn and take time, take notes, and reflect. Principal bacterial STIs, chlamydia, the most common bacterial STI and the most commonly reported infectious disease, right? This is leading the league in STIs. This is on the top. It's number one, it's chlamydia. Gonorrhea is the second most commonly reported notifiable disease in the United States. Urinary tract infections. Urethritis is an inflammation of the urethra, right? So this is only acquired by women. This can result from sexual exposure and non-infectious conditions, also known as NGU. Figure 6 is chlamydia. Rates of reported cases by sex, United States from 2000 to 2018. right? You'll see a breakdown in the age group. Take time, take notes, and reflect. Principal bacterial is STI. So syphilis as a genital ulcerated disease caused by a bacterium. Spirochete is a spiral-shaped bacterium, often called the Great Pretender because signs and symptoms are indistinguishable from those of other diseases. Progresses through 3 discrete stages: primary, secondary, and latent. This can be successfully treated by antibiotics in the primary, secondary, and early latent stages. The principal viral STIs, HIV and AIDS. Diseases caused by viruses are treatable but not curable, right? HIV and AIDS represent an enormous public health challenge nationally and globally, claiming millions of lives. When the AIDS epidemic became at its height was in the 80s, before there was a lot of research out, we made assumptions. It was only through science and research where we were able to acquire more information to treat this disease properly. So AIDS is the acronym: Acquired Immunodeficiency Syndrome. HIV is the human immunodeficiency virus, HIV, which causes AIDS. So if you see in as you'll see in chapter 16, we'll do a deep dive into what causes HIV and AIDS and the differences between those. And we talk about principal viral STIs or genital herpes. Genital herpes caused by herpes simplex virus. They have type 1 and type 2. It's common in the United States. And some will find that if you have a reoccurring cold sore on your lip, that is typically affiliated with herpes simplex 2, found and related from the sores that viruses cause. So between the outbreaks can be released from the skin that does not appear to be broken or have a sore. So most infected people have no or minimal symptoms. There is no cure, but there are medications that can help keep the virus in check. So principal viral STIs, the genital human papillomavirus infection, right, or often known as HPV because that's a mouthful, a group of viruses that includes more than 100 different strands. Most common STI among young sexually active people. This is being passed back and forth like ping pong. Certain types of HPV can cause genital warts in both men and women. So other HPV types can cause cervical cancer and less common cancers such as vulva, vagina, penis, anus, and throat. HPV vaccines protect against the health impairing outcomes of HPV infection. So principal viral STIs or viral hepatitis. Hepatitis is the inflammation of the liver, right? So the most common types of hepatitis virus that can be transmitted is hepatitis A and B. Hepatitis A is transmitted primarily through oral contact with food or water contaminated with fecal matter. Hepatitis B, which is highly infectious, is spread through sexual contact in blood, semen, saliva, vaginal secretions, and urine, and can be prevented by a vaccine. So hepatitis C is passed on primarily through contact with infected blood and often develops into a chronic infection. So symptoms of all forms: fatigue, diarrhea, nausea, abdominal pain, jaundice, darkened urine, and an enlarged liver. When we talk about vaginal infections or bacterial vaginosis or BV, bacterial vaginal infections that may be caused by a number of different organisms. Most commonly, Gardnerella vaginosis, often a normal inhabitant of the healthy vagina. An overabundance can result in a vaginal discharge, or odor, or pain. It could lead to itching or burning. Most common vaginal infections in women aged 15 to 44 in the U.S. and common among pregnant women. Can clear up without treatment, but antibiotics are recommended to prevent infection of the uterus and fallopian tubes and reduce the risk of some STIs. Vaginal infections, so genital candidiasis. Candidiasis, also known as a yeast infection. That's a scientific term, right? That's a scientific term for a yeast infection, a common fungal infection that occurs when there is an overgrowth of the fungus Candida albicans, right? A lot of these are derived from the Latin word, right? And is always present in the body, right? So it's rare in men, but nearly 75% of all adult women have had at least one case in their lifetime. And this can be promoted by birth control pills, antibiotics. You know, birth control pills are known to disrupt the chemistry in a woman's body. So this could also lead to genital candidiasis, frequent douching, right? Pregnancy and diabetes. When you douche too much, it disrupts the natural chemistry cleansing mechanisms that women naturally have. So, less commonly transmitted through sexual intercourse, typically treated with antifungal drugs. Trichomosis is an STI caused by a single cell protozoan parasite, Trichomonas vaginalis, most common curable STI, most common in women, more common in women than men, sexually transmitted during penile vaginal intercourse or vulva to vulval contact, right? Prescription drugs are effective in treating trichomoniasis, right, or commonly referred to as trick. To prevent reinfection, both partners must be treated. So other STIs. So several other STIs occur less frequently in the U.S. than in some developing countries, like chancroid, caused by the bacterium Haemophilus, right? Or cytomegalovirus, also known as CMV. This is a virus of the herpes group, which affects people with depressed immune systems. So enteric infections, intestinal infections caused by organisms normally carried in the intestinal tract, right? Granuloma, right? Lymphogranuloma venereum, molluscum contagiosum, right? All of these scientific STIs, all of these scientific terms for STIs are challenging to pronounce, as you see. Scabies, right? A red, intensely itchy rash caused by the barely invisible mite, Sarcopus scabi. So usually appears on the genitals, the buttocks, the feet, the wrists, the elbows, the knuckles, the abdomen, armpits, shoulder blades, or scalp. So this is treated with a prescribed lotion, right? So public lice, commonly known as crabs, which move from the hair of one person to that of another, usually found in the genital area on pubic hair. So can be transmitted during sexual contact. Prescription and over-the-counter treatments are available. Infections caused by STIs, pelvic inflammatory disease. In addition to the direct effects, women are vulnerable to complications from STIs that threaten fertility. So pelvic inflammatory disease occurs when bacteria move from vagina or cervix into the uterus, fallopian tubes, and other reproductive organs. One of the leading causes of female infertility. 1/3 to 1/2 of causes are associated with gonorrhea and chlamydia. Symptoms vary from none to settled to mild to severe. Cervicitis, an inflammation of the cervix, the lower end of the uterus. This might be a sign of genital tract infection, most often caused by STIs such as gonorrhea, chlamydia, genital herpes, or trichomoniasis, right? So high risk sexual behavior puts women at greater risk, as does having a history of STIs. And that's common sense. If you have high risk behaviors, if you have multiple partners that you're not having this conversation with and you're unsure of their sexual promiscuity or accountability, then that may lead to some of these STIs. Since signs are not often noticed, the infection may be discovered only in the course of a regular pelvic exam, right? Cystitis. Cystitis is a bladder infection that affects mainly women and is often related to sexual activity, not transmitted from one partner to another. This is characterized by painful burning, urination, and nearly constant need to urinate. Occurs when bacterium such as Escherichia coli, normally present in the body, is introduced into the urinary tract. Delayed treatment can result in damage to the kidneys. Now, preventing and treating STI. How to avoid STIs is practice abstinence. That doesn't work for some people, but practicing sexual exclusivity, meaning you and your partner agree to be sexually active only with one another. Right? This what happened in a relationship. This what happened in the marriage. Most marriage, more relationships, unless you have that conversation about the openness of an open relationship or marriage. Select partners carefully. Reduce risk during sexual intimacy. Avoid numerous partners. Avoid injection and other drugs. Get tested. Get vaccinated. Right? Protect babies and be a good communicator. Preventing and treating STIs continues. So practicing health promoting behaviors will prevent others from acquiring an STI. Recognize STI symptoms. Seek testing and treatment. Get partners. Get partners to treatment. Okay. So we covered a lot. We covered the STI epidemic, principal bacterial STI, principal viral STIs, vaginal infections, other STIs. We covered ectoparasitic infestations. We also looked at preventing and treating STIs. This has been an STI. This has been a very wordy type lecture, with different words, different STIs that are challenging to pronounce, but you can go back. That's the thing about an online class or watching a lecture video, that you always have the ability to go back, pause it, and look up some of these terms and take a deeper dive. All right. Hopefully you have learned a lot. Now, when we have that video from Planned Parenthood, when they give their lecture and they talk about contraceptive measures that have to do with birth control. Some have to do with the male condom, the female condom, dental dam. There are a number of ways that we can reduce the spread of STIs. And furthermore, when one acquires an STI, we should do our due diligence of alerting your partner, letting them know what's going on. Communication is everything. If communication is effective, that could also reduce the spread of STIs. So we want to stay informed. We want to make intelligent decisions. And we also want to teach others. So I am Professor Alexander. This is chapter 15.